Have you ever woken yourself up with your own snoring, or spent the night listening to someone else snore so loudly it felt like you were trying to sleep next to a tractor? You're not alone. Snoring affects millions of people around the world every single night. But what exactly causes it? Is it just annoying, or is it actually dangerous? And most importantly, how can you stop snoring naturally without medication or surgery? Stick around, because in the next 20 minutes, we'll explore the science behind snoring, why it happens, and what you can do about it, starting tonight. Snoring is the sound that happens when air flows through your mouth or nose while you're asleep and encounters some sort of resistance. This causes the tissues in your throat, like the soft palate and uvula, to vibrate, creating that familiar snoring noise. It can be soft and occasional, or loud and constant. When you sleep, the muscles in your body relax, including the ones in your throat. For some people, these relaxed muscles partially block the airway. As you breathe in and out, the air struggles to pass through, and that struggle creates vibration, aka snoring. It's a common condition, and while it can affect anyone, it's more frequent in men and people who are overweight. It also tends to worsen with age. There are many reasons people snore, and understanding the cause is the first step toward finding a solution. First, let's talk about sleep position. People who sleep on their backs are more likely to snore because gravity pulls the tongue and soft tissues downward, narrowing the airway. Then there's nasal congestion. If you have allergies, a cold, or a deviated septum, the airflow through your nose is restricted, which forces you to breathe through your mouth and increases the chances of snoring. Excess weight is another major factor. Fatty tissue around the neck and throat can compress the airway, making it narrower and more likely to vibrate when air passes through. Alcohol and smoking also play a role. Alcohol relaxes your muscles even more than usual, increasing the likelihood of airway obstruction. Smoking irritates the airway and contributes to inflammation, which can worsen snoring. Lastly, anatomical issues, like enlarged tonsils or a naturally narrow airway, can make you prone to snoring, regardless of lifestyle. Most of the time, snoring is harmless, but in some cases, it could be a sign of something more serious: sleep apnea. This is a condition where your airway becomes so blocked during sleep that you stop breathing temporarily. These pauses in breathing can last several seconds and happen dozens or even hundreds of times per night. People with sleep apnea often snore very loudly and then suddenly go silent, only to gasp for air moments later. This cycle disrupts sleep and prevents the body from entering deep restorative sleep stages. Sleep apnea is linked to high blood pressure, heart disease, stroke, type 2 diabetes, and even depression. If your snoring is accompanied by daytime fatigue, headaches, or mood changes, it might be time to consult a sleep specialist. Now for the part you've been waiting for: how to stop snoring naturally. Let's start with changing your sleep position. Try sleeping on your side instead of your back. You can even use a body pillow to keep yourself in position throughout the night. Nasal strips or a nasal dilator can help open up the nostrils and improve airflow. This is especially helpful if you snore because of nasal congestion. If you drink alcohol, try cutting back, especially before bed. Alcohol relaxes the throat muscles too much, which makes snoring more likely. Lose weight if needed. Even a small amount of weight loss can reduce the fatty tissue around your neck and help open up your airway. Use a humidifier to keep the air in your bedroom moist. Dry air can irritate the tissues in your nose and throat, which might contribute to snoring. Practice oral exercises. Yes, mouth workouts. Simple exercises that strengthen the muscles in the tongue and throat have been shown to reduce snoring over time. Stick to a regular sleep schedule. Going to bed and waking up at the same time every day helps regulate your body's natural rhythms and can reduce the likelihood of snoring. If you want to keep snoring from becoming a problem in the future, here are some additional tips. Avoid taking sedatives before bed. unless prescribed by a doctor. Like alcohol, they relax the throat muscles too much. Try elevating the head of your bed by a few inches. This helps keep your airways open. Stay physically active. Regular exercise, even without weight loss, has been shown to reduce snoring in some people. And don't underestimate the power of good couch sleep hygiene. A quiet, dark, and cool bedroom makes it easier to fall into deep sleep and stay there. So, what have we learned? Snoring isn't just a quirky sleep habit. It can be a sign of deeper issues, or it can simply be a result of lifestyle and sleep environment. The good news? In many cases, you can reduce or even eliminate snoring with simple natural changes. If you found this video helpful, give it a thumbs up and share it with someone who might need a better night's sleep. Don't forget to subscribe for more sleep science, wellness tips, and calming content to help you rest easy every night. Thanks for watching, and sweet dreams.